So magnesium has a normal value of 1.6 to 2.6 milligrams per deciliter. It's an important lab value to run, and we will run it often to monitor for patients with renal failure, chronic alcoholism, and a lot of times with cardiac arrhythmias. A lot of times we'll do our magnesium and our potassium, and then our cardiac injury profile if we have a patient whose EKG has changed, or if we suspect there might be some sort of cardiac issue going on. So magnesium is a cation, and it's necessary for several things. It's necessary for protein synthesis, nucleic acid synthesis, muscle contraction, ATP use, nerve impulse conduction, and blood clotting. It also affects the absorption of sodium, calcium, phosphorus, and potassium. So it plays a role in a lot of places in the body. And the place that I have seen it used most, and the reason I have normally seen this lab drawn, is for the muscle contraction side of things and for the cardiac arrhythmia side of things. If you have a patient who comes in with a normal EKG, you're monitoring their EKG and you notice changes. You might notice a U wave or something like that. You would notify the physician, and a lot of times magnesium level will be drawn. So if you start to notice EKG changes, the first thing you should really do is look at the most recent labs, look at a potassium, look at a magnesium, see what they are, and then notify the physician and see if you can get an EKG, see if you can get a mag, see if you can get a potassium. So some of the things that would cause elevated magnesium levels are things like renal insufficiency, also uncontrolled diabetes mellitus, Addison's disease, dehydration, hypothyroidism, overuse of antacids, or tissue trauma. Now, with all of our electrolytes, I want you to understand that you're going to see increased levels of the electrolytes when the patient is dehydrated. And to understand that, you really just have to think about, let's say you have a set amount of electrolytes in your body. If your volume goes down, if your fluid goes down in your system, you're going to have a higher concentration of those electrolytes. So for our patients who are volume depleted or for whatever reason have low volume or are dehydrated, we're going to see their electrolytes are going to be a bit higher, okay? Some reasons we're going to see their decreased level would be alcoholism, DKA, malnutrition, malabsorption, diarrhea. A lot of patients will lose magnesium via diarrhea. So they would see that, obviously also with diabetic acidosis, which would, be like metabolic acidosis, okay? So with metabolic acidosis, we're going to have a lot of diarrhea. We would lose a lot of magnesium, and so we'd see our level of mag depleted there. So magnesium is an important one to look at. A lot of times we overlook it because it's not, part of our BMP, but it's an important one to look at. We'd want to run our BMP with a mag, which would allow us to see more what's going on with a lot of our electrolytes and be able to kind of see, what might be the reason for any sort of arrhythmias, how our patient's responding, or if, certain conditions like the diarrhea or possibly dehydration or whatever is leading to either high or low magnesium levels. All right, guys, that's magnesium. Hope that helps.
Thank you for listening to our podcast today. Nursing.com is the trusted learning hub of all future nurses, your secret weapon for passing nursing school with your sanity intact. We want to invite all our listeners to visit us online and take advantage of a special promo offer. Just head over to nursing.com/free. That's nursing.com/FREE, and check out the free resources and other goodies that we have there just for our podcast listeners. Until next time, go out and be your best self today. And as always, happy nursing.